Hi guys, I am Aniket Katkar. Today I am here to discuss about the types of adverse events. Majorly, the adverse events are the undesirable experiences which are associated with the use of medical products or interventions. They can occur in various contents such as clinical trials, post-marketing surveillance or the routine patient care. Now we will discuss about the main types of the events. Firstly, it is the adverse drug reaction, means the ADR. The next is medication error. Third, the infection, device-related events, therapeutic failures, psychiatric events, cardiovascular vascular events, and the hematological events. Gastrointestinal events are the last, and the last is the dermatologic events. These are the main 10 types of the adverse events. Now we will discuss about firstly the adverse drug reaction, means the ADRs. These are harmful or unintended responses to the drug at normal doses or normal state. ADRs can be classified into two main categories, such as the first is type A, means the augmented reactions. These are the dose dependent and predictable, often related to drugs' pharmacological effects. The examples include the hypoglycemia from insulin overdose and the gastrointestinal bleeding from the non-steroidal anti-inflammatory drugs, means the NSAIDs. Type B is the bizarre reactions. These are unpredictable and not dose dependent, often related to the immune reactions, which examples include the allergic reactions. Examples the anaphylaxis, idiosyncratic reactions. Example the liver toxicity from certain anticonvulsants. The next is the medication error. This involves the mistakes in prescribing, dispensing or administering the medications. The common types of medication error includes the wrong drug or dose prescribed. Example are the prescribing the wrong medication or incorrect dosage administration errors. Example is giving the drugs via wrong route. And third is the infection, which are occur due to the medical interventions, particularly from or in the surgical settings or from immunosuppressive therapies. Common examples include the surgical site infections, and the next is the catheter associated urinary tract infections. Now next we will discuss about the device related events. These are the adverse events which are related to the use of medical devices. They can be included in as the malfunction of any devices. Example, the pacemaker failure, means the injury from devices. Example, burns from electrosurgical equipments. The next is the fifth, means the therapeutic failures, which occur when a treatment does not achieve the desired outcome, leading to the worsening of the patient's condition. And their examples are the failure of an antibiotic to clear an infection, ineffectiveness of chemotherapy in tumor reduction, and next is the psychiatric events, which is the main event of adverse drug reactions. With some medications, particularly those affecting the central nervous system, can lead to psychiatric events. This may include depression, anxiety, exhilaration, psychosis, or hallucinations, which often associated with the corticosteroids or certain antibiotics. Cardiovascular events involve the adverse reactions or adverse cardiovascular events, which can occur with only various treatments. Example includes the myocardial infarction or stroke due to the certain medications. Next is the arrhythmias induced by drugs. The next is major is the hematologic events. These events include the issues related to the blood components, such as thrombocytopenia, which means the low blood platelet count from drug effects, or hematolytic anemia due to an immune response to the drug. Gastrointestinal events, means the many drugs or treatments that can lead to gastrointestinal complications such as the nausea and vomiting from chemotherapy, diarrhea from the antibiotics or other medications. This was the information about the types of the adverse events. Thank you guys.